and Deputy Director of Communications. We have a full agenda today with Mayor Fischer, Dr. SarahBeth Hartlage, Associate Medical Director with the city's Louisville Metro Public Health and Wellness Department, Dr. Chuck Anderson, Chief Medical Officer, Baptist Health, Dr. Steve Hester, Chief Medical Officer with Norton Healthcare, Dr. Jason Smith, Chief Medical Officer with University of Louisville Health, and Dr. Ruth Carrico, Nurse Practitioner and Professor with the Division of Infectious Diseases at the University of Louisville School of Medicine. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. Thanks, and we'll get started here in just a few seconds.
Well, hello, everybody. Thanks for joining us this morning. So we've had quite the ride with the pandemic, and you'll recall that early on, one of our greatest concerns with the coronavirus, which when we started this thing was unknown and unpredictable, was that it would overwhelm our hospital system with this tsunami of illness that we could see from it. We didn't know, but we certainly had a lot of advance notice when we saw images of overwhelmed hospitals across the oceans, and then it started here on the West Coast, moved from here, started in the Northeast. We just have gone through this cycle time and time again. It got closer and closer to us here in Louisville. Now, there's no question that Louisville's medical systems have felt the strains of COVID-19, and our healthcare workers have been through a really, really difficult time. They were hoping that they were going to be behind that. Obviously, that's not the case. You know, we celebrated our healthcare heroes as if, we were past this. Clearly, we're not. So I really want to, again, express my immense appreciation for our healthcare team in Louisville, helping us get through these waves of the virus. And once again, how they're stepping up in the face of real adversity, in the face of now when we have a vaccine that could help us avoid a lot of what we're going through right now. We've all known that we've seen with COVID-19, it is a wily foe. It is a dastardly virus. And we've learned that we have to stay humble to it, because when we make a move, it makes another move. And its job, obviously, is to overwhelm us, and it does a nice job trying to do that. And we continue to hear reports of overwhelmed hospitals here in the Commonwealth. And while we're very busy here, we're not overwhelmed in Louisville, and we hope that we're never going to be that way. This call, we're going to get an update from our partners at Baptist, Norton, and UofL about the status of our hospitals. Because of the highly infectious Delta variant, our hospitals are again feeling the strains of COVID-19 in ways that we were hoped behind us, not only in admitting COVID patients, but the number of folks that are waiting for other procedures or waiting in the ER now that's full of folks that have COVID issues. So overrun hospitals are obviously bad news for anybody who may need medical attention, whether that be scheduled procedures or emergency visits. So that's what we're always concerned about, and particularly in times like this right now, when people are saying, well, that'll never happen here. That's what people have said in all communities, and we've done, relatively speaking, a better job, but that doesn't mean it's going to stay that way. So stay humble to the virus. And unlike back in March of 2020, or these frightening days this past winter, we now have a tool that does miraculous work in stopping the virus in its tracks. More and more people, it seems like, are getting answers that they felt like they didn't have and are getting vaccines. So we're seeing a slight uptick in that, but nothing like the early days of the vaccine. I'm hoping that the news yesterday, when we got the long-awaited news from the FDA, will help. And so the FDA has granted the Pfizer vaccine its approval for people 16 and older. And we all know that FDA has the highest and most rigorous standards in the world. And some people have been saying, well, I'm going to wait until the vaccine is FDA approved. Okay, you don't have to wait anymore if that's what your concern was, and you can go on and get the vaccine. And this is confirmation that the vaccine is highly effective at preventing serious illness and death from COVID-19, and it does a great job of preventing COVID-19 infections. And obviously, it's safe as well. It's the best thing for you and your family to move safely forward. So today is a great day to get on the path to vaccination. So many people are like, okay, I'm ready to go. We got over 100 spots in the community where you can get your vaccine right now. So please, if you're thinking that way, get in your car or get on your sidewalk or whatever it's going to do, and please get vaccinated. Now, beyond the strenuous review of the FDA, we know that tens and tens of millions of people have gotten the vaccines and are benefiting from the protection they deliver. So there's a lot of evidence all around us. They're showing up in our case numbers and our hospitalization numbers and our death numbers from folks that have not gotten the vaccine. We know that people still have some questions. Some people do, and we understand that. And if that's you, please talk as soon as possible with your doctor or a pharmacist or a loved one about your concerns or hesitations so you can go ahead and get the vaccine. You'll hear this a lot today, and that's because we care and we want to do everything possible to protect you, but also our community as well, and so we can keep our kids in school. You're seeing reports here in Kentucky and from around the country that some of the schools are closed. People are going back to online instruction, all the things that most people have said that they don't want to have happen. And we're also wanting to make sure that we don't put the ultimate strain on our hospital. And bottom line is we want to avoid serious illness and prevent deaths. So please help us in that endeavor. And the way to do that is to get the vaccine or convince somebody that's not vaccinated to get that vaccine. So we'd like to always start this call with our data. So I'm asking Dr. SarahBeth Hartlage with our Public Health and Wellness team, leader of LouVax, that was at the fairgrounds at Broadbent, and now it's mobile in the community. It's been doing a heck of a job for us. If she would review the data. Dr. Hartlage.
Sure. Thanks, Mayor. So as I'm sure it comes as a surprise to no one, we are still in the red color code, red incidence rate with 3,226 new cases last week. That gives us an incidence rate of 60.1. And, we're coming up on our highs that we hit back in the winter. So our positivity rate, the highest one we had was January 25th, which was a positivity rate of 14.39%. And currently we're at 13.11%. So we're nearing the worst numbers that we saw earlier in the year. We had 14 deaths last week, and that's the highest number since March as well. And again, we are seeing an impact on younger folks. So of those 14 deaths, 2 were in their 40s and 2 were in their 50s. So younger folks getting hospitalized and even dying from this viral illness. We can scroll down a little bit. The vaccine dashboard here. So one positive bit of encouraging news is that the folks getting their first dose of the vaccine are inching up. So people are going out and getting that vaccine. We have 59.9% of our residents who have received a first dose of vaccine. That's about 460,000 people. And 51.9% of people who are fully vaccinated. That's 398,000. So we continue to see events as the top exposure setting where people may have contracted the illness. And that includes the usual gatherings with friends and families, but it also includes things like gatherings like concerts, sporting events, going to church, going to restaurants, things like that. So we are seeing some people who are even getting infected potentially from outdoor events. So it's important to keep those mitigation measures intact, keeping things like wearing your mask and distancing, and then of course getting your vaccine when you are able to do so. And regardless of your vaccination status, we encourage people to get tested regularly, and especially if you have any symptoms, to stay home and get tested. I'm not going to go through the hospital dashboard because we have the experts on that on hand today. So I will leave that to them to talk about their capacity. And we'll go back to you, Mayor.
Thank you, Dr. Hartlage. So obviously, folks, it's a grim situation we're painting here. And so now let's go into each one of the hospitals. We've got with us Dr. Steve Hester from Norton, Dr. Chuck Anderson from Baptist, excuse me, and Dr. Jason Smith from U of L, the respective chief medical officers, trusted, longtime supporters throughout the community have been providing great information to us. So if we could just, why don't we run through to you guys, if you each kind of describe what's going on in your hospital systems, observations, concerns that you have, and then we can get into some more questions. So Steve, I want to start with you first.
Sure. Thanks, Mayor. Thanks for the opportunity to share the information today. And you know, we have seen a continued increase. You know, as Dr. Hartlage had recommended, just shown, we're near our peak. When we were back in December, we had about 221 patients in the hospital. We're at 197 today. The key fact on that, though, is that only 18 of those are vaccinated. So you take 197 patients, that basically means 179 are not vaccinated. And when you think about that, I think an interesting fact on that that's important to highlight is that the folks that are vaccinated, their average age is 74. And we know that when people get vaccinated, they get a less immune response, you know, as they get older, sometimes to the vaccine. But the average age of those that are not vaccinated is 53. So clearly we're seeing an unvaccinated population. It's a younger population. From a ventilator standpoint, we've got about 35 patients in the ICU on a ventilator. Again, the younger population. And from a capacity standpoint, I think we're managing capacity right now, but we are very full. You know, when we see a number of patients coming into the immediate care centers and the emergency departments, we're managing that. But certainly, just it is, as the mayor said, it's just so important because the vaccine will make a difference in this, and it shows that in our hospital numbers.
Thank you. Dr. Anderson?
Thank you. Yes, I agree with Steve with what we're seeing for some reason, and to his point about the vaccination with patients, we're seeing about 25% of our patients are vaccinated. And I think classically at our hospital, we have a little bit older population. However, we're running about 76 patients in the hospital right now with COVID. This is just our one hospital. We maxed out about 100. If you look at our system that includes 9 hospitals throughout the state, we are already above our max from last year. About a month ago, we had about 100 and something. And just this morning, I think we were over 425, 430 throughout the state that's in our hospitals. Our critical care unit, we have 16 patients. Of those 16, 3 of them are on the ventilator. We're using a lot of high flow oxygen to maintain them without needing the ventilator just yet. The 3 ventilator patients are 40s and 50s, and the vast majority of them in the critical care unit are 40, 50, and 60s. We have a couple folks who are 70 years old, and only 2 of them in the unit are vaccinated. And as Steve said, they're also the older population. We had to start backing off on and delaying some of our surgeries because we are, same thing as Steve said, getting pretty maxed. Staffing, people are tired and working hard and doing great care, but at the same time, just getting maxed out from what they've been doing. And so backing off some of the surgeries have allowed us to staff up better. And also backing off on some or delaying some surgeries allowed us to accept more critically ill people from other hospitals. So we're trying to be that reach out point to take care of folks as well. So it is a little bit more stressed right now. I agree with what you said, Mayor, and also what Dr. Hester said. The vaccinations are making a difference. If you're vaccinated, you're less likely to be in our hospital and definitely less likely to be sick in the critical care unit.
Thank you. Dr. Smith from U of L.
Yeah, so I'll echo exactly what Steve and Chuck said. We have 144 in-house today. That's only about 10 less than we had at our peak, which was right about 150, a little 155 to be precise. Of those, I think 7 of them are vaccinated. None of the ones in the ICU are vaccinated. Currently have 40 in the ICU. I think also, like Chuck, we have started to back off a little bit this week on many of our elective procedures across the system. For the same reasons he said, you know, at one point in time, we had 46 requests for transfers into the system from all over the state for people looking for beds. And so that was one of the ways that we could, provide the beds to the city and to the state as well. So we have had to do that this week. And I think, the system is stressed, but it is far from failing. I think that's the important part to remember is that we're able to manage this right now and urge everyone to get out and get a vaccine. I think, the numbers will show that I don't have anyone in the ICU and haven't for about 3 weeks now that had gotten a vaccine. And in particular, 95+% of the people that I'm seeing hospitalized right now did not get a vaccine. And if we only had 7 to 8 COVID patients in versus 144, we'd be in a very different situation across the board, I think, with all the healthcare systems.
Yeah. Have you guys found any, I know there's no magic to this, but in terms of convincing the vaccine hesitant to get their vaccine, either from yourselves or anecdotes that you're hearing from any of your teams, are you seeing anything that's more persuasive than it has been in the past? And what are you hearing with the FDA approval yesterday? Or do you think that's going to be helpful? Let's go backwards, Jason.
Yeah, I wish I had the magic bullet for vaccine hesitancy. I don't think so. I think when we found success, it's been a personal conversation between the people and either someone in our facilities that they trust and respect, or some of our medical providers have made the biggest difference. I think if you can get face to face and talk to people and kind of cut through all of the misinformation and things that are out there on the internet and kind of spread on the airwaves, that's made the biggest difference for us. And we started doing that with our own staff when we were looking at, the mandatory vaccines. The people that were hesitant, if you go have a conversation with them and can sit down and talk, you can oftentimes, bring them around to getting the vaccine and why it's important to do so.
Mm-hmm. Chuck?
Similar things to what Jason said, talking to our intensive care unit doctors, they still are frustrated that they are taking care of folks in the intensive care unit and they're talking to families and they try to bring up the vaccines to the family and they're still hesitant even though their family member may be doing poorly in the intensive care unit. So that's been frustration for the physicians and the nursing staff taking care of folks, that folks still don't want to go to get a vaccine despite their loved one being like that. The other thing that we're seeing a lot of recently, and kind of like Jason mentioned about the misinformation, is that they don't have, some of them have vaccines, some of them don't have vaccine, but they want other therapies that are unproven. And the just different medicines have been thrown out there before, the ivermectins, the hydrochloroquines and things of that nature. They want us to do that instead of, and some of them are still questioning using the standard of care that we know today is the standard of care. So that's causing a lot of stress among the physicians and the staff.
So this deworming medicine, I guess, is what you're referred to there. And so where's that coming from? Is this, again, just kind of the internet disinformation and people are coming in thinking that they're smarter than the medical profession and that they're going to get deworming medication is going to help them with COVID?
I think early on there was some data that reported outside the body and the Petri dish that if they got real high concentrations, it did kill the cells. But you can do that with a lot of things in the Petri dish, but it's hard to get those concentrations within the body, especially within the lung, the high concentration. So I think they're still living off that early data. There was a study done in March that said if you had mild disease, really did not see any difference. And there's definitely no data in people who are seriously ill. So again, there was some misinformation. I've seen some news articles myself where people are saying throughout the world, they're using this with success, but I have not seen any data. But I think it's misinformation.
And then Steve, last week, Dr. McKinney said that nationally, about 50% of breakthrough cases they're seeing in the hospital were in people that were immune compromised. Are you guys seeing that in the Norton system?
We are. So, in those breakthrough cases, like I was saying, they tend to be an elderly population that get hospitalized. And I think it's important for the public to understand that getting a vaccine, when you get immunity, doesn't mean that you get 100% protection. What the goal of these vaccines, that would be awesome if we could do that. But what it's really trying to do is minimize the effects of the patient. And so it's trying to certainly stop death and minimize hospitalizations. And we've seen that to be effective. Other than what we're seeing is in those immunocompromised patients, that's why the booster is approved. Certainly for those folks to get it. And again, the elderly population doesn't always respond as well to these vaccines. I think one of the challenges with the misinformation piece is that we've never seen sort of the scientific method on a scale like this as public before with any other medical therapy. And so every day when information comes out, it's publicized because everybody was just clinging to any piece they can get. And so what happens is a lot of the information gets out there before it's really verified. And so I think when you sit with someone, everybody has good intentions. They're trying to make the best decisions for themselves and their family. And I think when you have those one-on-one discussions, oftentimes you can help them understand other pieces of information they may not have seen that really does help people understand the value in the vaccination. And I think that's a big part of this.
Yeah. Yeah.
If I could, Mayor, one thing, someone had asked a question I didn't mention earlier about pediatric cases at the Children's Hospital. We've got 13 patients in-house. We have seen a bit of an increase in terms of pediatric admissions. Certainly, as you're aware, the 12 and under has not yet been approved. And so it is a little bit of an increase. And so we're starting to see numbers back like we did in December in pediatrics.
Yeah. Okay. Fine. And then I guess just last, anything from you all in terms of message? Governor Beshear said it's Healthcare Heroes Appreciation Week, and what can the public do? I guess beyond getting their vaccine in terms of helping the situation, anything that you all would like to share with the public? Dr. Smith?
Well, I'll reiterate, get your vaccine so that we don't have to meet in person. We can meet over the web or talk. I think the biggest thing is right now the healthcare industry is tired, and I think Dr. Anderson talked about it. Is everyone's tired? Everyone's been through this for 2 years now. They're still stressed. Now we're back to worrying about, can we take this virus home to our own families, even if we've had a vaccine, because of the amounts we're seeing. Have patience and be kind is the biggest thing I can tell people, particularly if you're in the healthcare environment or you wind up in the healthcare environment. We're doing our best, and we will make sure that you are taken care of to the best of our abilities. And sometimes that's not going to be as quickly as people would like. So just do your best to have patience and be kind. That's the biggest message I can have for everyone right now.
Very good. Dr. Anderson?
I agree with Jason, vaccine number 1 and 2 and 3. Unfortunately, over the last several months, we are seeing more, I hate to use the word anger or upset or just what he's saying, more lashing out to our staff as well with, healthcare violence. All of our staff comes in here to take care of all of our patients every day. If everyone can be nice to each other, that would be great in the hospital setting. Unfortunately, at times we are holding patients in our emergency department for beds. This morning we're holding 15 or 19 patients. So things are not running as smooth. X-rays are not getting done as quickly because of maybe decreased staffing because of either people trying to take a vacation that they have not taken, or they're on FMLA, or they have to be out of quarantine, which right now, quarantine staff, we're doing very well. But the main thing is we're all here to help and try to be nice. We'll be nice to you, and you'll be nice to us. And don't forget your vaccine.
All right. Dr. Hester?
Yeah, just reiterate a couple of the same things, but obviously the vaccine's the most important thing. But I'm just, one of the things, just so proud of the staff and everybody in the community for stepping up to take care of patients. I mean, these folks go in every day to make sure they're there and available for folks when they're sick. And just to reiterate the point earlier that the patience is important in the process, but kindness is important because I do know that when someone does ask you if you come in to wear a mask or something like that, just ask that you'd respond in a respectful way because we've got folks who really are tired. They've been doing this for a long time. And they get frustrated too. And just ask for patience and your willingness to understand that everybody's in a stressful environment.
All right, we're coming down to what our mamas all taught us when we were growing up. Be kind, be nice to people. All right. So if you guys would hang with us for some questions later from the media, we appreciate that. And let's now transition to one of the kindest people I've ever met, and that's Dr. Ruth Carrico. She's the infectious disease nurse practitioner, professor, and researcher with UofL, vaccine expert here and all over the country. And she's been another regular source of trusted information. She's here to talk to us today about boosters. So, Doc, in the last 2 weeks, the CDC recommended booster doses as soon as possible for people with certain conditions that are moderately or severely immune compromising. And then last week, President Biden and the CDC announced vaccine booster doses are recommended for everyone beginning the week of September the 20th and starting 8 months after an individual's second dose of Pfizer or Moderna. So we've been getting a lot of questions about that. So first, let's discuss the FDA approval. And for those of us that aren't scientists, what's this FDA approval mean?
Well, I think this is great to have the full approval of the vaccine. That just as others have mentioned, that this may drive then some of the decision making for people who have been hesitant, waiting for a full approval. So we hope that will be one way of getting through some of the vaccine hesitance, because I think it's important to remember that we have a lot of people that are living in different realities. That our reality as a healthcare worker, we are seeing this disease every day. We're seeing the impact every day, but this is not the reality that some in our community are seeing. They are not, they're not experiencing this to the degree that we are. So trying to convey those messages, offer opportunities, listening, as we've talked about, listening and respecting the rights that people have to express themselves and to accept vaccination, when it meets their needs as they perceive it, I think is important. So maybe the full authorization then will help with, move that forward. But as Steve mentioned, remembering that vaccination is not the only magic bullet, that it is a combination of activities, a combination of interventions, but certainly it starts with vaccination.
Mm-hmm. And so should we think about Pfizer now differently than Moderna and Janssen, or because it's going with the FDA approval?
Well, I think Pfizer has kind of plowed the way for a lot of the decisions. So we fully expect that Moderna will be right behind. I think we're waiting in terms of full approval right behind Janssen. I'm assuming will be then behind the mRNA vaccines, and then we'll see the same thing, I would imagine, with the booster doses. So I think they will all at some point then have this full approval, and then have some recommendation for booster doses in some combination. But I think that will happen.
Can you talk a little bit about the reason why boosters? So antibodies going down. I'm seeing that a booster now might even take your antibody level up higher than what it was before and last longer. So what do we know about all that?
Well, the antibody use is still kind of imperfect, at least from the part of the clinical perspective. What does it mean? Our antibody results mean that we don't always know how many, what's a home run? How many antibodies do you need? What are the types of antibodies that we have that we can detect in some of our tests? The challenges that we have with commercially available antibody tests. I know we had some patients the other day that brought in their antibody test, and we have a number. We don't necessarily know what that number means. We don't have that correlation between a given number and level of protection. And then over time, as your antibody levels diminish, like happens with most vaccines, we don't know at what point then that represents a greater opportunity for infection, and then what the severity of infection, what the correlation is between those numbers and severity of infection. So, so many questions that we are unable to answer with this virus and these vaccines that we may have been able to answer and may still be able to answer with other vaccines. And it hobbles us a bit in being able to address then the questions that come in, from the general public. And oftentimes, I'll get questions every day that'll be, gosh, Ruth, last week you said this, now this week you say that. that is often perceived then as a lack of knowledge or disorganization, instead of recognizing the change that we are seeing with this, as everyone has mentioned, this very clever and very ferocious virus that we're running to keep in stride. And sometimes we're ahead of it. Sometimes we fail and we fall behind. But it is our responsibility as clinicians to keep up with the information, try to weed out what is junk science and what is some measure of truth, but also recognizing that that truth changes the more we learn about the virus. So I would imagine then our approaches with boosters is going to continue to evolve. I think, as you mentioned, trying to get it into those that have immunocompromising conditions, those that are older. We will begin then to see the priorities as we have additional guidance for booster doses outside those severely immunocompromised populations, and trying to figure out then a good strategy, a methodology for making sure that we have vaccine readily available, that we are handling our vaccine well, because some of the vaccines I know are not particularly forgiving with respect to environmental conditions and how we manage them. So there's still a lot of these balls that healthcare is having to keep up in the air. Some of those balls are glass. You can't afford for them to drop. Some are rubber. It's okay if they drop and you bounce and you grab them on the way back up. And but it just reflects then the changing nature of healthcare, and that is another level of stress that is in the system that we are trying to account for and accommodate, so that we can continue to meet the needs of the community.
Okay, well, let's talk a little bit then about that with our chief medical officers. And Dr. Hartlage, I'll bring it back to you in terms of availability of the booster, how you all are going to manage that within your hospital systems, and kind of advice that you're going to give to folks. So, I mean, to be clear right now, so if you've had your vaccinations, both shots, what is it that you should be thinking about relative to this booster or third shot? So, Dr. Hester?
So I think, first, I think obviously if you have an immunocompromised condition, you want to talk with your physician and see if you fit in that category for an additional shot right now that the CDC's approved. We've been doing those since they've been approved. And so if you go to our website, it'll just ask someone, are you scheduling for a booster? And so if so, you can schedule that through that process. And then obviously early on, we have been using the Pfizer vaccine, but early on we did have some Moderna. So we've got that if someone initially got the Moderna. We've held some back to make sure we have that available for boosters. I think if the FDA were to approve, boosters for everyone, which it looks like that's the direction they're going, and potentially in September, we've got plans in place to be able to make those shots available and have it ready from a staffing standpoint to vaccinate individuals who've had their first two shots.
Mm-hmm. Dr. Anderson?
Same as Steve said, we're doing the immunocompromised, immunosuppressed folks now as well. There's an attestation that they can do and schedule on our website. Again, we're working on being ready September 20th to have the third injections available for everyone that qualifies at that time, which is the 8 months after your first shot and above a certain age, if that is what is decided upon.
Okay. Dr. Smith, anything to add?
No, exactly the same. We've started reaching out through the Brown Cancer Center and through our transplant clinics to preferentially schedule some of those patients that we know are in active chemotherapy or actively getting transplant doses of immunosuppressants, but also providing that to anyone in the community or any of our physicians that want to send patients through to the urgent cares or the offices where we're giving those. And it's a simple process with a simple attestation that you meet one of those conditions.
Thank you. So, Dr. Hartlage, does this mean that Louvax is coming back to Broadbent?
I'm happy to say that we're not in a position of needing that right now, although I do think we've proven that we can do it. And, if we were to need that sort of community-wide support, that's something we could discuss, although the Kentucky State Fair is occupying that arena right now. But as these gentlemen have said, we encourage people who have those immunocompromising or immunosuppressed conditions to speak with their primary care provider, confirm their eligibility, and then go ahead and get that shot When we move into boosters for everyone, I think that looks a little bit different, but hopefully people can still get shots through their primary care physician, through their local pharmacy, or through some of our mobile mission sites as well.
All right, very good. All right, lots of information today, folks, and we got a lot of questions from the media. So Jess, why don't we pop on over to them?
Okay, thanks, Mayor. Our first question comes from the Courier Journal, Debbie Yetter. She asked if Dr. Hester could speak to pediatric hospitalizations at Norton Children's, and he spoke to that during the briefing. So we'll move on to the next question. Mayor Fischer, this one is for you. It comes from Candace Cliff with WDRB. She asks, now that Pfizer's vaccine has full FDA approval, will you require city employees to be vaccinated?
No, that's a good question, Candace. So, what we've been doing is making different steps. So right now we're requiring masks from all city employees. We understand where we're at by each department on those. Several of the folks have been saying, we're waiting for FDA approval. So now that that's here, we're going to see what that uptick looks like as well. So we're just following each one of these steps as it comes before we end up going to a final step, which would be mandating the vaccine. So we're not quite yet at that stage. We're looking at the data to see how people uptake it now that the FDA has approved the Pfizer vaccine.
The next several questions in the chat are for our hospital CMOs. Chris Larson with Business First asks, Governor Beshear has said for a while now that we are a few weeks away from becoming like Arkansas, Alabama, or other southern states where the hospitals are maxed out. Do you see Kentucky facing that kind of crush of COVID patients? And we'll start with Dr. Smith.
Yeah, so obviously, we've been taking calls from all through the southern states to try and transfer patients into the system. And that's been going on for about a month now. Do I think Louisville could fall that way, or Kentucky in general? I mean, the answer is yeah, anyone could. And I think if you look at the healthcare systems in Alabama, Georgia, Louisiana, they're not bad systems. They're simply overwhelmed by the numbers they're currently seeing. I think the difference is we've had a really coordinated effort here within the city between the healthcare systems, and we're actually coordinating with healthcare systems in and around Louisville as well as Kentucky to try and not get in that situation. So our bed boards share information back and forth to move people around. We work with UK and the other big healthcare systems on the other side of the state, and so I'm hopeful that we will not. And the simple fact of the matter is we've done a lot to make sure that we have enough resiliency in this system to not fall that direction. But I suppose you never know, and I think it's important for everyone to get out and get a vaccine so that we don't fall into that mire that they are currently in.
Thank you, Dr. Anderson or Dr. Hester. Anything to add?
I would just throw in, I think us working together has helped us be where we are today. Within our own system, places like Corbin and Richmond and Hardin County, I know they're having a lot of difficulty with their numbers. During the first or second wave, they were down in the 10s and 20s when we were all very bad here in Louisville. Right now, I think Hardin is in the high 70s or 80s, and they're having problems with equipment that we're loaning them. Corbin's the same thing. So can it get here? Yes, but I hope with what we're doing and with our resilience and us working together that it won't get there. But without more vaccinations, it's always a possibility.
Nothing further to add. Thanks.
Okay, the next question comes from Chris Larson with Business First. He says, based on your read of recent data, will your Louisville area hospitals reach critical capacity? How long until your hospitals do reach critical capacity? And what is more likely to limit your capacity, beds in facilities or staff limitations? And Dr. Hester, we'll start with you.
So I think, when you look at the capacity, I mean, we're able to continue to expand to care for COVID patients. And I do think one of the important things when we look at where we were, in the beginning of the pandemic, when elective procedures were canceled, across the board, there were a lot of factors in that. First, a lot of unknowns as it relates to COVID, really limited supplies of protective equipment. So a number of things came into play. I think, at the hospital systems, we manage capacity every day, whether we need to postpone a procedure or do something like that to make sure we have space. So I think from that standpoint, I feel confident that each of the systems will be able to do that in terms of managing the capacity. I do think staffing is a challenge. It's a national challenge, not just here. I think you see that all levels of healthcare facilities have difficulties in terms of maintaining staff right now. It's a challenge. Staff are incredibly tired. They're looking for some of the different roles and different opportunities they might have in other areas of healthcare. So there are some where it's not direct patient care, which some folks are seeking a break. And so I think, right now that is a challenge, but fortunately those folks who've continued to stay with us and are fighting the fight. And I feel confident that we're going to be able to continue to care for this community.
Dr. Anderson, Dr. Smith, anything to add?
Yeah, I agree with Steve. I think staffing is going to be the biggest issue going forward just because of the fatigue. It is different today because we do know a little bit more. We do have the supplies, and I feel like we do have the beds. And every day we look at our surgery schedule and, what's going to predict next week. 2 weeks ago, we had more trouble. We made some changes, and then it was a better day finally. So again, we're all trying to be nimble and making changes going forward, and that's what we're going to have to do every day to make it useful. And if the COVID numbers can go down, then we make less changes. So that's what we're looking at going forward.
Yeah, I've got nothing to add. I think they did a great job.
Okay, thank you. We have 2 questions in the chat about elective procedures, so I'm going to combine those. The first one is from Marvis Herring with WLKY. He asks, how long are elective procedures being delayed, and what impact is that likely to have on patients? Doctors were just telling people not to delay going to the doctor for non-COVID issues. And the second question is from Chris Larson with Business First. He says, at this point, hospitals are under the strain of typical hospital patients on top of COVID patients. Do you anticipate another state elective procedure shutdown? It sounds like you would self-impose a halt on elective procedures as needed. Is that right? And we'll start with Dr. Anderson.
Back in March of last year, as Dr. Hester said, we didn't know what tomorrow was going to bring us, so everything was stopped. We learned a lot from that, and we learned a lot through 2020. We are making changes and delaying some procedures based on the need. So if there is a patient who can have a procedure delayed for 2 weeks without having harm, and if they have the procedure, they need to be in the intensive care unit, we're asking if that procedure can be held up because of the need of the critical care bed or the need of the telemetry mid-level bed, so to speak. So again, this is something we're doing daily, something we're doing weekly, and we'll make changes as we need to. But I do not expect a full stop as we did before or a big stop. If someone needs an outpatient procedure, joint replacement that goes to a medical surgical bed, if you need your colonoscopy, get your colonoscopy. We're not delaying any of that. So again, we're trying to narrow it to our need that we can continue to take care of patient care greatly.
Dr. Smith, Dr. Hester, anything to add?
Yeah, I think,
No.
the only thing I would add is, harken back to the early days where we talked about flattening the curve, if you remember that. And what we're doing by delaying some of these elective procedures is just flattening the curve of admissions that we have into our healthcare facilities. We're getting a lot through COVID and emergency departments and things like that. And so all we're trying to do is, for the most part, is spread those out over a period of time. And that's what I think will happen, temporary halts or delays in order to make sure that we can take care of everybody who comes through our doors.
Thank you. And Dr. Smith, the next question is for you from Marvis Herring with WLKY. Marvis says, this morning someone told me they were told by the ER that there was a 12 to 14 hour wait. He asks if you can speak to how long wait times are at your ER and urgent care facilities due to COVID.
So we haven't seen 12 to 14 hour waits. If UofL Health, if you would want to text ER wait to 511-511, you can get the up-to-date wait times at all of our emergency departments here at UofL Health. I think the highest we've seen is about 45 to 50 minutes. A lot of that depends on volume and depends on the number of patients being seen and As you might imagine, some ERs are busy, some aren't, and it's about giving the patient the opportunity to find out where's the least busy place that they can go to. So ER wait to 511, 511 will give you the most up-to-date information for our ER times.
Okay, the next few questions in the chat are about kids. The first question is from Marvis Herring with WLKY. He says, do you all have numbers for how many kids under 12 have been hospitalized since school started? Dr. Hester, do you have?
You know, I don't have those, Marvis, I don't have those available to me right now. If I'll work to get someone to get you that data. I just don't have it on the tip of my fingers.
Thank you. And the next question is also for you, Dr. Hester, from Candace Cliff with WDRB. She asks, are COVID positive children also largely immunocompromised children?
They are. And so you do tend to see that. And so, you know, you've got a lot of kids with chronic illnesses, chronic conditions, and COVID certainly does complicate that situation for them. So a lot of those kids do end up in the ICUs. And so that has been a big component of that. But, you know, one of the things too that we've really seen a push, we're right now, just to tie into that, I mean, we tested 2,500 people yesterday for COVID. That's the most we've tested during the entire pandemic. And so on a daily basis. And so we're continuing to see that increase every day. And I think, you know, we do see that there are a lot of kids getting tested in the outpatient setting. And kids are, you know, positive on that outpatient setting. Unfortunately, we don't see, you know, a huge number of those hospitalizations. And when you think about it in context, from the beginning of the pandemic, we've had 197 children hospitalized. That's 197 too many, but in comparison to what we've had on the adult side, it's far lower.
Thank you. Our next question is for Dr. Carrico. Comes from Debbie Yetter with the Courier. She says, some continue to claim COVID-19 in kids is no worse than flu or RSV, and she'd like to get your thoughts on it.
Yeah, I think I hear that a lot. And certainly kids typically, as with most infectious diseases, may not exhibit the degree of symptoms, the degree of illness that we see in adults. But that doesn't mean that the risk is not there. And so certainly categorizing COVID with other more seasonal illnesses that we see really isn't respecting the nature of that virus. And I think it is also important to remember that what children experience, children then are able to transmit to others. So looking at them as little independent beings is, again, not respecting the nature of this virus, that they in turn have the ability to take this home, transmit it to mother, father, grandmother, grandfather, and others who then may not do as well as the child does. I think Steve mentioned the low rates of hospitalization among children, but that doesn't give the full picture of their abilities to, you know, really be very efficient transmitters within our community. So, you know, we're asking people to, as we talked earlier about kindness, we're asking people to realize that what we are really asking you is to do something for others, not only for yourself, but for others as well. So the impact of this disease extends well beyond the single individual and into the community. So trying to compartmentalize disease very narrowly, I think doesn't really help give the whole picture of the importance to the entire community.
Thank you. Our next question comes from Marcus Green with WDRB. This question is for our hospital CMOs. Marcus asks, to the best of your ability, can you quantify what kinds of staff shortages or departures you're seeing because of burnout, vaccine requirements, or other factors? And we'll start with Dr. Anderson.
I hate to use the word departures. Our main problems that we're having are folks, you know, being off on FMLA, people being off because of their child going to school and maybe being positive in quarantine. It's more of those issues versus people leaving the workforce. Obviously, we have had some folks leave the workforce, but I think the vast majority of it is related to those other issues that they can't be at work that day for whatever reason.
Thank you. Dr. Smith, Dr. Hester, anything to add?
Yeah, I mean, I think if you look at the staff really across the board, we're low on staff in lots of different areas. Nursing, techs, phlebotomists, you name it. I think there's multiple different reasons for that. I think the job market is wide open and people can go and do anything right now. I also think there are lots of pressures and competitive pressures for nursing, not necessarily in the city as much as really nationally. I mean, we've had people travel and go to all over the South to help, just like they went to the Northeast to help last spring. And so I think when you see something like we're seeing now, it's just difficult in managing the surge. I think we'll be fine in the long run. But I do think, it's the labor market for healthcare has changed in the past year. And adapting to what this new labor market looks like for nurses and for techs and for everybody doing their jobs is going to be important for our healthcare system as well as for the city.
Yeah, I would agree. I think it's just we've seen a change in the workforce. And I think, and one of the challenges is, I mean, for years, we've had challenges with certain positions, whether it might be certain types of technicians, different, skilled positions that we really needed from an educational background, the colleges and institutions to continue to produce. And so that's one of the things I know each of our institutions has worked with those to try to grow that workforce. And I do think that we're just seeing some changes, and COVID has put a stress on that. It's put a stress on families in a number of ways, and people are looking for flexibility in their schedules, the way they, may have had to cover things at home differently. And so I think that contributes a lot there. If I could just add to Marcus for your question on the pediatrics, for ages 2 to 12, in August, we've had 10 children admitted. And I looked back at December too, and in December we had 10 at the same time, so of those same ages. So it's pretty equivalent in both sort of the peaks of when we started seeing those cases go up as it relates to pediatric admissions.
We have a few more questions in the chat that we'll try to get to before the end of the press briefing. If we're unable to get to your question, I'll follow up with you offline. Our next question comes from Marvis Herring with WLKY. He asks, do doctors think a mass vaccination site would be beneficial in helping them focus on actual cases? We'll start with Dr. Hester.
I don't think so. I think one of the things that we've really focused on is we have the vaccination opportunity now within our primary care offices, our pediatric offices, and our OBGYN offices. And so that's a number of locations of where we're able to touch people and then really have one-on-one discussions with individuals about vaccination. We continue to have our mass vaccination site available in St. Matthews on Breckenridge Lane. It does some volume there, but it's available. We've got vaccinations available in our prompt care locations. And so our goal is to make it easy and accessible in multiple locations where you can have one-on-one discussions with the provider. So I don't think a mass site really does help. I think weaving it into when people get normal health care is going to help them have those discussions to really help us get people vaccinated at this point.
Yeah,
Dr.
I'd
Anderson.
agree. Yeah, I'd agree with Dr. Hester on that one. I mean, we've kind of run the course of the mass vaccination sites. I think they were useful early on, but now we've got so many other touch points within the community that's really the easiest way to get the vaccines out into the community is giving someone 100 different places across this city between the 3 different healthcare organizations where you can go and get a vaccine. And it's never more than about a 10-minute drive from wherever you're at. And I think that's what will get, people vaccinated much better than trying to drive to the stadium lot or downtown or to one of those sites. It's so much easier to go to your local physician or go to your local healthcare provider or one of these urgent cares, have a discussion and get the vaccine.
I agree with that too. The personal touch is what's needed.
Okay, we have time for one additional question, and then Chris Larson and Marvis, I'll follow up with you separately. The last question comes from Candace Clift with WDRB. This is for Dr. Carrico. She says, we often hear that adults transmit to children more than children transmit to adults. What advice can you give to parents of children too young to be vaccinated?
I think one opportunity is to work with the daycare facilities and try to encourage not only vaccination among all of the childcare workers, but have then those activities that reinforce basic infection prevention and control. You know, children, when you look at a small child, you know, everything is in their mouth, everything is, you know, just their social interaction. So we know then that there is, you know, ready movement of many infections that we typically see in children. COVID is just one example of these transmissible infections. And then I think reinforcing then the activities within the home. Again, that the actions that have been mentioned, vaccination, testing, staying home from work when you're ill, just realizing that the whole nature of all of these activities, infection prevention activities working together. And then being on the watch for when vaccination becomes available for children as those age ranges continue to drop. And then being encouraging and active in immunization.
Thank you, Dr. Carrico. And that's the last question in the chat.
Okay, well, thank you, Jess, and thanks to all of our healthcare professionals for joining us on the call, Dr. Carrico and Dr. Hester, Dr. Smith, Dr. Anderson, Dr. Hartlage. It's been a heck of a ride, and we're far from over, but thank you all for your stamina and persistence and passion toward keeping people well. And I think I can close by saying it's all of our wish to please, folks, if today's your day to get vaccinated, please do so and help more folks to do that. And that's the best way that we can honor and respect the folks in our healthcare profession that are doing their best every day to keep us all healthy and safe. So thanks for joining us, and we'll see you next week.